Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. So, welcome to the today's YouTube live session, where I am Dr. Nikita Nanwani, your radiology faculty at the platform of PrepLadder. And today we have with us the best of the first year MBBS faculties here with us. So, we have Dr. Rajesh Kaushal, sir, our anatomy faculty. Good evening, sir.
Good evening, Dr. Nikita.
Then we have Dr. Shanmugapriya, ma'am, our biochemistry faculty at PrepLadder.
Hi,
ma'am.
hi, Nikita. Hi, students.
And yes, we have our physiology faculty here, Dr. Soumen Manna, sir. And hi, good evening, sir.
Good evening, Dr. Nikita, and good evening to all students.
So I'm pretty sure that none of us need introduction for any of them. We will dive into the discussion for the today's session, and that's basically focusing on how you should be dealing with your first year of MBBS. So now the next batch has come, basically the current batch of students who has entered into first year of MBBS. All of us have been through that, and we have experienced how difficult the first year of MBBS is, the sudden transition from the 11th and 12th standard to the first year of MBBS. And the majority of our time in the first year of MBBS goes in getting oriented itself, right? By the time we get oriented, we realize, oh, the first year is gone. So we do not want anybody of you to face that. So that's why all of us are here to help you, strategize for first year in the best way, so that you do not regret later, oh, we should have done that in our first year. Maybe we had someone who could guide us, what you should have done in the first year of MBBS, right? So Gautam is saying the voice is low. Let me just check. Is it fine now, Gautam? I've tried to increase it. Right. So before we even start with our formal discussion, I am very curious to know, because this is the first time that even I'm getting to interact with the faculties here one-on-one. And so I would like to know from each one of you as well, the difficulties that you faced during your first year of MBBS. How was your first year of MBBS? What are some things that when you look behind and you think that this is something that you could have done better? Probably if you had someone who could guide you, you could have done it much better. So basically, let us help our students learn from our lessons and from our mistakes. So starting with Rajesh Kaushal, sir. Sir, so what do you remember from your first year of MBBS?
Welcome, students. Dr. Nikita, when I look back, I very clearly remember the very first day of my going to the class. And the evening before that, basically, we just bought the book Cunningham. And as everybody knows, Cunningham has British English and very difficult to comprehend. And on the very first page, we were told that by our seniors that you should be doing first 18 to 22 pages. And then you should come to the first day of college. And on the very first page, we spent about half an hour and we couldn't make out like what is proximal, what is distal, what is medial, what is. So what I understand is don't get stuck up with because as you already have mentioned, we are in 12th standard and suddenly we are in college scenario, and the way we are being taught there is totally different. So it may come to you as a surprise, or you may not be ready for that. But definitely within a week you will be very compatible with the mode of teaching, because your seniors will be helping a lot. So my first advice is always try to have a frequency matching with your seniors, because they can guide you a lot and they can tell you exactly what to do, and plus you can follow the instructions given by the teacher as well. If you are talking about anatomy, the best you can do is always go to practicals like dissection hall. You should visit as the schedule is allowing you, and all the labs. So I believe like in the beginning, we were not that oriented. That orientation is very important, and that orientation is given by your seniors, first of all, and then the teachers. So that is what I felt, Dr. Nikita. In the beginning, Cunningham was too heavy for me, actually.
Absolutely, sir. Like I believe all of us agree to that. It takes us back to our first year of MBBS, and we used to think, "Kahan aa gaye ye?" That is the feeling that we used to have. I totally agree to that. Coming over to you, Shanmugapriya ma'am, how was your experience, and what do you remember from your first year?
So that's a lovely way of starting this strategy session, Dr. Nikita. So I did not want to join medicine. So the first year, the first 3 months went on by me being passively aggressive, trying to evade MBBS. I thought if I don't study well, I'll be taken off from MBBS course. So that is how my first 3 months went on. And even before I could realize what is anatomy and what is physiology and what is biochemistry, of course, like any of us, I was also bombarded with internal assessments. And even before I could realize how to prepare for these internal assessments, I was bombarded with university exams. So like any of us who are here, I also looked up to seniors. I got a list of important questions for university exam. I just crammed it. I just went on, I wrote it in my university exam and came off. And the main purpose of this session is is to avoid any of you who's watching this session following what I did. So we are here to support you in such a way that you will not have to cram any of the subjects. You will be able to understand every subject conceptually.
True that. I think it comes as a surprise to all of us that ma'am did not want to join medicine, and here she is as the best biochemistry faculty that can ever be. So that's going to be a great motivation, I believe, for the students, that initially you might think that it's difficult, you don't want to do it, but slowly and gradually things set in and you would be in a very good shape eventually. Yes, coming over to you, Soumen Manna sir.
Yes. So I joined a government college in Kolkata. And before joining, I was the toppers of my school. So during class 10th and 12th, I was the toppers. Now, the first thing that I came to know after joining the medical school, that everybody is topper there. So some of you also may feel this kind of situation that everybody around you is a toppers of their school. So you should not lost in between. The second major problem that I have faced in my first year is the language problem. Okay. And I believe many of the students will feel that kind of problem after joining, because many of you are from Hindi medium or a different kind of medium. So that problem will be solved within 2 to 3 months. And nowadays, as you know, okay, there is a foundation course given to every colleges. So in that foundation course, the language problem is also taken care of. So you don't have to worry about your language problem. Okay. At my time, I was suffering from the language problem because I was from Bengali medium and everything is in English. The third problem that I faced, as Dr. Kaushal sir told, that anatomy was difficult. Obviously, it was difficult, but somehow I was understanding anatomy, lateral, medial, or tuberosity, or what you know. But it was very difficult for me to understand physiology, and it was very difficult to remember biochemistry. That was my one of the most genuine problem in the first year. Every time I go for a viva or a kind of group discussion, I was not able to recall anything in biochemistry. And physiology, in my time, there was a book. That book obviously is still there. So in that book, if you start reading, they will read everything, they will write everything in one page. And after the end of the one page, they will write down that now this theory has been obsolete. So after giving your all energy, or after understanding one page matter, then you are understanding that it is obsolete now. Now you have to understand the current theory. So that way it was very difficult for me to understand physiology. Okay, I was managing somehow anatomy, and biochemistry was a very, very volatile for me. So that was my biggest three problems in my MBBS life I could recall right now. So what do you, Dr. Nikita?
Okay, so totally agree to you, sir. And I think the students are blessed these days, because we will also come to the discussion of how The language problem is being taken care of even by PrepLadder platform by giving them the prep vocab feature, which helps them understand the terminologies, when they'll be solving the questions. We have that feature that being added on the app. We have recently added where the meaning will be given so they don't have to worry about, oh, I don't understand this term in the question. So I think the students in this generation are really, really blessed in that front. Right. Coming over to the discussion, I think a lot of students who have joined the first year of MBBS recently, I'm sure would be struggling with, coping up with the lectures. Let's say if they miss a particular lecture, then how do they cover that front? Or let's say that if they want to go to the lecture, prepared, I'm not going to the lecture blank, at least I have some orientation. So how they can make the use of videos that we have on our platform during the first year. We also want to break the myth that PrepLadder videos or the videos on any platform are only for, preparing for your PG entrance exam. So we would like to reiterate the fact that it's not only for the PG entrance exam, but it's also very important to help you understand the concepts well before in time, and, how they can best, make use the best of the videos that we have on the platform for the first year as well, and also to prepare for their next exam that would be coming up for this batch when they would be in their final year, right? So starting with Shanmugapriya ma'am here, what is your take on what is the importance for the students to watch the videos that we have on our platform during first year, how it can help right from the first year?
Yeah. So when I started this discussion, I was saying that before you could realize what is happening around you, you have to face so many tests and so many exams. And this means, and also when you have to learn medical science, it is quite unique in a way, because in medical science, any subject, you cannot delineate topics. It is completely interlinked, be it anatomy or physiology or biochemistry. Let me give you examples in biochemistry. If you don't understand chemistry of carbohydrates, or if you have not learned chemistry of carbohydrates, you will not know what is ribose 5-phosphate. Without knowing what is ribose 5-phosphate, you will not know what is a nucleotide. Not understanding that, you will not understand genetics. And unbelievably, there is a link between the first topic in biochemistry and the last topic in biochemistry. So this means you will have to learn every subject, every topic in an interlinked manner. And that would be easy for a student if the entire subject is taught by a single subject matter expert. Every medical college has got a great set of faculty, but it is not practically possible for them to give or allot one faculty to discuss all topics of the subject. But if you watch, so if you have a resource in hand like PrepLadder, wherein every subject is being handled by one faculty, and that faculty links the first topic with the last topic. And even when the first topic is taught, for example, I would say ribose 5-phosphate is the foundation for you to form a nucleotide. And that is the foundation for you to form a polynucleotide chain. So from the very beginning, we link every topic and we discuss every topic conceptually. So this is a resource which will be in your hand, which you can use at your own convenience, at your own pace. So for example, biochemistry, there are 46 hours of regular videos. And even if you spend just 2 hours a day, 2 days a week, you are done with the entire biochemistry in the first 12 weeks of your first year. And NMC specifies that you have around 57 weeks for the first year. So the remaining weeks, you have it all for yourself, for revising and for concept building. So this is how this is one way by which watching videos in your first year will help. And the other way obviously is the next exam. So you will have to appear for an exam in which questions will be asked in all 19 subjects. And you're not given enough time because this exam is going to be written before your internship. This means you will have to be on top of your academics from the first year. So that is going to be possible when you have a resource like PrepLadder in your own hand. And the third reason is the evolution of question papers. So till some time back, we used to have more of factual MCQs, one-liners. And now the same question is being twisted. It's asked as a case-based integrated MCQ, which means you will have to train your brain from the very beginning on how to apply the knowledge that you gain. So what we have done in PrepLadder is each and every one of the 19 subjects will be discussed conceptually in an integrated manner. So if you start watching these videos from the very first year, then you would have trained your brain in such a way that in the final year, you will not face any hassle. It will be a cakewalk for all of you. And of course, before you go and watch, you go and attend your lecture class. If you watch any of these videos, it will prime you to think and to question or to raise your doubts with your lecturer, and you can get your doubts clarified real time. So I would say watching videos from the very first year would be a boon for you when you write your university exam and when you write your next exam.
Thank you so much, ma'am, for that valuable inputs. And when you were saying, I was realizing, oh my God, biochemistry is so easy. It's done in 46 hours. The first year MBBS students actually struggle with biochemistry. You know that, like Soumen Manna sir also mentioned, many of us look at biochemistry like very dry and very volatile subject. But I can vouch for that. If anybody watches your lectures, they would fall in love with biochemistry. Soumen Manna sir, we could just hope we could have got faculty like Shanmugapriya ma'am when we were doing our first year of MBBS.
Exactly.
Yeah. Now over to you, Rajesh Kaushal sir. What would you think would be the correct way of watching anatomy videos for a student who's in first year of MBBS?
That was a fantastic take, Dr. Priya. And as Dr. Nikita is giving me the same question, I'll just take example of one of my cousin who has just recently joined your MBBS first year. He is in first year. So the guidance which I gave him, I'll just repeat my words. I told him that what is your style of learning? Means what is your schedule? How do you divide your day? In which kind of schedule? Are you a person who wakes up early in the morning or stay late in the night? It depends. But say, for example, and first of all, what we should do is, what a student should do is, the syllabus which you have, say, for example, in anatomy, you have gross anatomy, neuroanatomy, histology, embryology. You have to make a list by your hand, in handwritten. And you should also whether ask your ask your teachers or ask your seniors what is going to be the schedule. Say, for example, usually in our Indian setup, we start with upper limb. So in upper limb, when they will be doing brachial plexus, when they will be doing forearm muscles, when they'll reach the hand muscles. So you should write down the sequence of classes and the dissection module also. Then you should go through PrepLadder app as well and mark where exactly those lectures are. So, say for example, I have just joined MBBS and tomorrow I have a class. It starts with upper limb and usually they'll start with hand. They'll ask you to dissect the skin of the hand and take out the superficial fascia, deep fascia, all that. So that way you can actually start with the same thing in the app itself. In the app, there are topic-wise, the syllabus is again topic-wise, and we have tried to match it up with the way MBBS curriculum is. So, say for example, let us say brachial plexus. Now, brachial plexus, if tomorrow I have having a class of brachial plexus today, maybe late night or early morning, I'll wake up and I watch the video for brachial plexus. Maybe it'll take some 40 minutes. And when I'm watching that video, means the students are watching my video, the same time they'll be going through the notes also. So simultaneously, they watch the video and keep looking at the notes, underline the notes. Don't make any notes watching our videos because notes are already made there. And then once it is finished, you can go to your theory class. In theory class, they'll teach you brachial plexus, some details. And after that, there'll be dissection. Go through the dissection. Always you have to attend the dissection hall. There is no excuse to miss your practical classes at all. May it be clinicals, may it be your basic sciences, may it be biochemistry lab or maybe physiology lab. You have to visit those labs because they teach you a lot, the basics. And once your dissection is over, you come back. What you do is you find out the topic in your book, the book which have been prescribed by the institute. Say, for example, normally students will be reading from B.D. Chausia. So mark the topic from B.D. Chausia. But as you come back, you go through the same video which you have seen early in the morning or late night, and go through the same video again. Maybe this time make it faster, 1.5 into 1.5, or maybe make it into 2, and quickly go through the notes and then read from your textbook, which is prescribed textbook. I believe this will be helping not only in your gross anatomy, but also in histology, embryology, neuroanatomy. So this is what I told my cousin, and this is what I'll tell you all the students. I think this works quite well.
Absolutely, sir. Agree to that. And the major advantage of watching the lectures videos before going to the classes, you can actually show off in the class कि मुझे इतना आता है. And like, let the other students feel that, oh my god, we are with some superhuman person जिसको सब कुछ आता है, but they don't know the secret कि they are watching the PrepLadder videos. That's the secret behind there. That's great. And I think this answers, we have our viewer here, Sujan Kumar Behra's question, that how to use Rajesh sir's anatomy lectures. And sir, he's saying he totally loves how the way you use diagrams to sum up everything. I think this answers his question. And also Sujan's again another question, that how to use the lectures, what should be the sequence. I think Sir Rajesh sir has described it very, very well in a proper manner, that how we should actually be doing it. Coming over to you, Soumen Manna sir, do you think that watching the videos during the first year will help the students even for their university exams or for their Viva exams?
Yes, absolutely. I'll explain this. So whenever you are joining in the first year, now all of you have heard that the schedule or the curriculum that you are following is known as the CBME curriculum. That is a competency-based medical education, and it has been introduced from 2019, as we know. So NMC wants that every Indian medical graduate should be competent enough to deal with each and every cases, right? So that way, the whole syllabus of the first year as well as the other MBBS curriculum has been changed a little bit. Change means the core topic has not been changed, but in each and every topic, the NMC has set one competency, that from this topic or from this subtopic, what is the main thing that you have to learn? What is the main thing that you have to understand? The concept. And in the CBME curriculum, you also know that the question pattern that will be asked in the university exam, that has also been changed. Previously, what we used to get as a kind of short note, some kind of numbers or values or something like that. But now the NMC has given a clear-cut guideline that at least 20 to 40% question will be case-based question, clinical case-based question. Means one clinical case will be given, and from there some question will be asked. They're not going to ask you the diagnosis, but they're going to ask you the core concept from the clinical case that is given to your university exam. So now you can understand that the same physiology, the same subject, you have to read in a more detail, in a more depth manner, so that you will be able to understand the core concept of that topic, right? So this is for your university exam I'm talking about, not for the NEET PG. Okay. So to understand that core concept, it is very, very important to listen the lecture videos, because I can take guarantee that whatever lecture I have taken in physiology, they are arranged in a particular sequence, the sequence that generally followed in the classes or that followed in the medical school. And each and every topic is purely conceptualized. So physiology, it's a subject of concept. If you don't understand, I'm not saying the other subjects are not conceptual, obviously they're conceptual, but physiology, only concept is there. If you understand a concept in physiology in a better way, you'll be able to understand your pharmacology, your pathology in the next year. Okay, so that you have to build the concept from the first year only. And I can take guarantee that if you watch the videos, okay, before your lecture class, I'm 100% sure that you are going to understand each and everything of the lecture in the class, right? So that is one of the most important thing, that watching video from the first year. Second important thing is that sometimes we don't want to, we don't understand that in my exam, if the same question is coming, suppose one topic, the resting membrane potential question is there, and you have read that topic from books, okay, but you don't know that which point you have to highlight in your answer. which point you have to write at least to get decent marks. So that way, I have highlighted in each and every lecture that this is one of the more important point in my videos. Okay, so that way, this videos is going to help you immensely, so that I can take guarantee of that. So that's all from my side, Dr. Nikita.
Thank you so much, sir. I absolutely love the confidence, and I believe the faith that you have instilled in the students that if they watch the videos, we have taken full efforts, to deliver our best. So basically, we have tried to get the essence of the multiple textbooks that are available in the market, and we have filtered it all. And we have delivered what is the essence, what helps to build the concepts, and what helps them both for their university exams and for their PG entrance exams as well. Before we go on to the next one, also I would like to ask each one of you, there must be some topics which are not asked in the university exams. We all have seen that, when we came to the PG entrance, we realized, oh, this is something that we never read or we were never taught in our college, because that's not asked in the university exam. Personally, I would tell you that we used to have that the book, just my previous sub questions, university ke question papers used to be there. Just see from, what topic is being asked, read only those for the university exams. And I think that would suffice for us to get a good score. But then we have seen ourselves that, students who are performing great in their university exams might not necessarily do well in their PG entrance exams as well. So there is something, that extra ingredient or those extra topics that are required to be read for the PG entrance exams. Now, especially that we said that the exam will come when the next comes in, it comes in final year. So now the students will not have time to, we'll do the extra topics in the internship before the PG entrance exam. So I'm sure this would help the first year students to understand. If I ask you that, what are the top 3 or top 5 topics from your subject which you think are not asked in the university exam, and we don't read them in our colleges, but they are important for the PG entrance exam. So starting with Soumen Manna, sir.
Yeah, for my subject, there are a few topics in central nervous system. Like one topic is molecular mechanism of memory and learning, that we generally do not ask in the exam for the first year. And another topic I can remember is in case of cardiovascular system, the regional circulation. The circulation of the brain, the cerebral circulation, or the circulation of the heart. Those are the topics not very common in the exam point of view for the first year, but that you have to understand for the PG entrance examinations.
Okay. Rajesh Kaushal, sir?
Dr. Nikita, what I understand is of course, for first year MBBS, this is the way, as you mentioned, you should go through the last 10 to 12 year previous year questions, and you will be able to understand what the examiner is interested in asking, and usually the topics are repeated. It happens the same with the even PG entrance exam. I have seen 60 to 70% questions are always from repeat topics. I'll add that what I have observed in my total experience of 21 years, I have been watching this PG entrance exam for since 2001, because I gave my PG entrance in 2000. And since 2001, I have been watching. There are some gray areas. Now, what is a gray area? Say, for example, I'm teaching anatomy, liver segments, Cunard classification of liver segments. And you are in radiology, you understand that that question can be asked even in radiology. They can give you a radio CT scan and mark 1, 2, 3, 4, which segment is this? Now, the thing is, say, I know that Dr. Nikita is teaching liver segments, but Dr. Nikita will not be teaching the very basic anatomy, because she will assume Dr. Kaushal would have taken this much. And it is true. And similarly, when I'm teaching liver segments, I'll start from embryology, then I'll go the 2 segments, 4 segments, 8 segments. Then I'll slightly touch the radiology section, but will not go into detail, because I'll assume that Dr. Nikita will take her. But sometimes there's a mismatch. So for that, it happens that I will be watching your lectures, you will be watching my lectures, so that there should not be any discrepancy. But still, there is some discrepancy, and the examiner is very much aware of that. What examiner does is, he will ask something which I'm not teaching, thinking that radiology people would have taught, and radiology people will not be teaching, thinking that NRP people would have taught. So there is a gray area. So that is where I have my expertise. I have mentioned that a lot many times. I will take you and encroach into radiology subject and leave where Dr. Nikita is very comfortable and taking further. And this happens not only in radiology, this will happen in physiology also. Dr. Manna will be amazed that how come Dr. Kaushal is teaching so much of physiology and encroaching into my territory? But that is required. That is very much required. So that is how of course, I cannot encroach into Dr. Priya's territory because we are actually totally different arenas, but still, say, for example, if she is talking about this bilirubin metabolism and all that, I will definitely move into the ducts and all that. Means try to make student comfortable and move into slightly into territory of biochemistry also. And of course, then where you don't find anatomy, I'll be encroaching into pathology, into surgery, into OBG, into anesthesia, into dermatology, into radiology, of course, into orthopedics. I actually encroach into almost medicine, pediatrics, whatever. And that is my way of teaching, because I have seen there are a lot many questions which go unanswered, because I will feel that this is not my territory. Like you must have felt this in your internship. When a case comes, we keep now jumping the case, refer to orthopedics, refer to radiology, refer to. So we are very good at referring cases to other departments. But here what I do is I refer the cases to myself only. So I encroach into other departments, but then I'll make sure that it doesn't mean that I have to teach total radiology, because of course Dr. Nikita is the expert, Dr. Manna is the expert. I should not encroach, though I may be reading latest edition of Guyton, latest edition of Sutton Radiology. I read all the latest edition of medicine. If you ask me, 21st edition of Harrison, but I limit myself. But that gray area is my expertise, and gray area is the area where questions are being asked. Now it is interdisciplinary, and these days they don't even include 2 subjects. What they do is they include 3 subjects. They'll start with anatomy, move into physiology, and then ask a radiology question upon that. So interdisciplinary approaches, and that is what all of us are expert in, because we cater to students according to the type of questions, the pattern which is changing. And this is what the student will get the best from us, because we do not limit ourselves to our own subject.
True that, sir. I mean, we are happy to know that the basics of our subjects are being taken care of you. So that gives us now I will be considering कि हाँ Kaushal sir ने cover कर लिया होगा, and I'll move a step ahead. Quickly coming over to you, Shanmugapriya ma'am, the top 3 topics you think in biochemistry are not important for university but important for NEET PG.
Yeah. So my answer would not be much different from what Dr. Rajesh sir had mentioned. It is more or less like it won't be topics, Dr. Nikita. It would be about how we handle those topics. For example, in the first year, we will be taught about mucopolysaccharidosis. We will be taught about congenital adrenal hyperplasias in biochemistry. But what we won't be taught about is why there is salt wasting form in 21 beta hydroxylase deficiency. Why do we see hypertensive form in 11 beta hydroxylase deficiency? Many a times we won't even tell them that 21 beta hydroxylase presents with salt wasting form. But what is being done, what needs to be done for a student to be prepared for facing NEET or next is, they should know how will the patient present if the patient has got a particular enzyme defect, and why. Because not knowing why, the student will not be able to make a diagnosis. I'm a strong believer of the fact that your eyes will not see what the mind does not know. So only as long as the student understands why there is salt wasting form, the moment that the student sees a child presenting with hypotension, with a pseudo-hermaphroditism feature, immediately the medico would know, okay, this is 21 beta hydroxylase deficiency. So I would say there is a difference in the way we approach all these topics for a student to be able to face NEET or next when compared to when a student has to face the university exam. And to add more information about it, there are few topics, of course, as you said, they are not being taught in the first year. For example, protein synthesis and sorting. like what Rajesh sir had mentioned, I would say, okay, this will be taught in physiology. And physiology, people would think, okay, this is taught in biochemistry, but neither in physiology nor in biochemistry, we take steps to tell them why or how a pre-pro protein becomes a pro protein, how a pro protein becomes a protein, what is rough endoplasmic reticulum, what is the role of ribosome, when is it synthesized in free ribosome, what do we mean by protein targeting defects. So there are so many, as Rajesh sir had mentioned, there are so many gray areas which go unnoticed because of the segregation in the subject. And when they watch videos which are in PrepLadder, I don't think they will face this difficulty, because every gray area gets covered by all of us, because we are worried about missing out any aspect of any of the topics that we discuss. So as they finish the first year subject, when they go to the next year subject, they will have a clarity in understanding pathology, pharmacology, and microbiology, because they have a strong understanding of first year subjects. So I would say that is the difference between NEET and next when compared to university exam preparation. And I would also like to answer, I think somebody had mentioned that one of his seniors, Deep Kumar, had mentioned that one of his seniors said he was asked to touch biochemistry in the last 2 months before exam. So when a student tries to do, I mean, of course, you can follow your seniors' advice, but I would like to tell you all that seniors are still students. Okay, so you don't have to blindly follow what your seniors say, because if you try reading biochemistry in the last 2 months before your exam, you will not be able to understand the subject conceptually. You will not be able to apply the knowledge which you gain in the last 2 months. So do not do this. I would say that start preparing for all 3 subjects from the very beginning, and spend enough time in understanding all the subjects, because you cannot be in a hurry to establish something which has to be long lasting. If you're going to hurriedly read biochemistry in the last 2 months, my assurance to you is you will hate the subject. But if you start learning from the beginning, you will understand how relatable biochemistry is, how applied biochemistry is, and your perception for the subject will differ. So that's about it.
That's great. And I know one thing I would like to add on. The first year students, if they are here, you might be feeling that we are just in our beginning days. The videos will be very hi-fi, something that we will not understand. But let me tell you, it is the other way around. The videos, the concepts that we have delivered are in a way, because we know that, I'm pretty sure that the faculties that we have for first year subjects, they teach in a way, making sure that if a first year student is watching the videos, even they should be able to understand. And let me tell you, there's nothing that a first year student cannot understand, right? Our brains have already developed. So whatever is being delivered to you, you'll be able to understand. So please take the first movers advantage and trust us when we say that you need to watch videos right from the first year. And I can tell you honestly that I'm not saying this because I'm a faculty at PrepLadder, because I am your well-wisher. That's why I'm telling you that it's definitely going to help you long time if you start watching videos right from the first year. And as ma'am said, if you learn the way like she has delivered biochemistry, sir has delivered physio, or Rajesh sir has delivered anatomy, you would fall in love with these subjects, rather than majority of the students who develop that thoda sa hatred for MBBS. It is very, very difficult. So please do it right from your first day. Very, very important. And the other importance of watching videos is also that, like Soumen Manna sir mentioned, the language problem that we face. Suddenly, you will have those hi-fi textbooks that you'll have to read for MBBS. You might not be able to read or understand or grasp them, because the way that language is put up, it's a bit difficult to understand. But that is what we have done in the videos, is we have delivered it in the simple language, because Indian faculty, so we have put out the content in a way that our Indian students understand that concept very well. The way that we have been taught throughout in our school, in our junior colleges, that's the way that we have put forth. So whenever you are not understanding anything from your standard textbooks, your videos at PrepLadder are your go-to resource. They will help you to understand that concept. So watch the videos and then get back to the standard textbook if you want to get that sense of completion. Okay, I've read that standard textbook. It will help you assimilate the content there. Going on to the next one. Coming to the role of notes that we have already they are delivered at PrepLadder with the video lectures associated. So Soumen sir, what do you think? How can the student in the first year MBBS make the best use of the notes that we have?
Yes. So in first year, ki whenever you are entering in a medical school, every colleges they will give a sets of list of books that what textbook you have to read. Okay. So for physiology, ki there are certain international author textbook, and as Nikita ma'am told, ki there are some Indian author textbook also. So generally, what students start with, they start with the international author textbook. I have seen this for the last 14 years. Okay. But after a few months, when they don't able to understand the concept, then they go back to the Indian author textbook. And after going back to Indian author textbooks, what happens? They found out that there is huge number of syllabus, right, to cover up. So how to cover up this huge number of syllabus, even after reading the Indian author's textbook? So here, the notes of the PrepLadder is going to help you. So, in first year, as far as I remember, in physiology, there are a total 180-hour lecture in first year MBBS physiology, right? So that 180-hour lecture, I have reduced to in my lecture into 60 hours. And almost all the content, whatever is required for the first year is there. And all those video lecture content is there in the note. So you can make your own notes. Some of the students have the habit of making their own note. But the thing is that there is time constraint, right? You have to attend your lecture class. Otherwise, your attendance will be shortage, right? So you have to be there in the medical school from 9 a.m. to 4 p.m. And then you come back home or hostel. And then you have some leisure time and some sports activities. So after doing all this thing, there will be very few time where you will be able to make your own note. Okay, so that's the point where we are taking care of with this PrepLadder notes. So you can take the notes, okay, and you can just watch the video, or what you can do, you can first read the note a little bit and then watch the video. And then, as Nikita ma'am told, then you can go back to the textbook and you will be able to understand the textbook in a very lucid manner. There will be no problem in understanding the concept, no problem in understanding the topic. So that way, use the best use of the note. And if you want to write something onto the note, please add on to that, right? So whatever is there in the note, if you're getting some extra information from your lecture class or from your school, okay, I mean medical school, you can add on to that note and read the same note again and again, rather than making multiple notes or multiple textbook or changing textbook, because there is a visual impression, okay, eye impression we call it, right? There is a memory form in your brain whenever you are reading something again and again. So that way it is going to help you. So please do use the best use of this note. Okay. If you are able to make your own notes, very good, but that is very, very time consuming. So use the notes of the PrepLadder, which we have cross-checked that whether the notes are properly written or not. So that way you can take guarantee that notes are also in proper line. So that's from my side, Dr. Neeta ma'am.
Yeah, true that. And I also believe that especially the first year subjects are such that, they are not going to change over a period of time. Like physiology will not change, anatomy will remain the same. Biochemistry, there might be some new, the enzyme drugs or targets that might come in, but otherwise the basics will remain the same. So what I also understand is if the students, like you rightly mentioned, sir, use the notes from the beginning itself, adding on the points to the printed notes itself, the same notes for which they have made a visual memory, they can also use later on when they are appearing for NEET PG or next. So they don't have to get a new resource again. And so they'll have that assurance that chalo, our 3 subjects are done for a PG entrance. So I think that gives a, feel good wala feeling that chalo, 3 subjects are done. And that would be good ahead. And I'm pretty sure, sir, that Rajesh sir ke diagrams are very well known and we have them in our notes. So, sir, I'm pretty sure that your diagrams are going to help students to get that easy visual memory of the difficult anatomy relations, what is anterior, what is posterior. I think that's the most difficult part that we struggle with in anatomy, right, sir?
Yes, that is very correct, Dr. Nikita. The orientation in anatomy is very important, and that is what I try to orient the students at the first go. and I'll teach. Basically, these days they are asking dissection-based questions also. So we have included all the dissection images, histology images, even pathology images are there, radiological images are there. And eventually, like say I have a lecture for 30 minutes, the last 5 minutes I'll be summarizing it in my own line diagram, which I don't know, students like very much, maybe because they are simple, easy to understand, and quickly you can revise everything within 5 minutes. So that expertise we have gained during course of time, and that will be definitely helping the students a lot in university exam as well as in NEET PG exam.
True that, sir. I mean, I have seen your line diagrams myself, and I'm a personal fan of those, so I can vouch for them.
Thank you.
Yeah. Going on to the next point here. So the students, you can also see as well that when you are watching the videos, we also have the MCQ discussions that are being done along with the video lectures. Something which makes the video lectures at PrepLadder very, very unique if you compare them with your, the college lectures, because the faculty at college, like sir mentioned, there's time constraint. So of course, they will not have a lot of time to discuss the MCQs. But at the same time, you have to solve MCQs, of course, for your NEET PG, but for your university exam also now. So, Shanmugapriya ma'am, if you could throw some light on how you have integrated the MCQs in the topics that you have delivered in the videos.
Yeah. So, so starting from my view on the notes, so I would like to tell all students who are watching this video on how to use notes and videos and the Q bank that is available on the PrepLadder platform in a particular sequence. So what a student can do is the student can first go through the notes. Suppose the student has decided to watch the video on a particular topic, say protein synthesis and sorting. The first thing the student can do is can take the notebook, can take the notes, the printed notes that is available in PrepLadder, can read it once. Of course, when you read it for once, you will not be able to grasp all facts and concepts. But after that, when you watch the video, you will be able to relate to every fact and every concept that we educators are trying to tell you. And after doing that, when you're also shown MCQs, so the way we have included MCQs in all our videos is, number one is all the MCQs will be clinically integrated as shown in the slide that you see here. This is a case-based MCQ. A 2-month-old boy presented with ambiguous genitalia, his blood pressure was normal, then what is the probable diagnosis? So this is a case-based integrated MCQ. And for you to answer this MCQ, as I told you, you will have to understand conceptually how an adrenal hormone is synthesized and what is the function of those hormones. And then you will have to understand what will happen when those hormones are not getting synthesized by the adrenal cortex. So it is completely integrated. And as you can see here in the slide, it's also PYQ. It's a previous year question which was asked in FMG. So you start training your brain in answering such integrated MCQs which have been asked previously. So as you all know, your brain is plastic, right? It's not elastic. Luckily, it is plastic. So you can stretch your brain so that the brain can function the way you want it to. And that practice should start from the very beginning. And that's what you're going to do from the first year. So after you solve these MCQs along with the educator, we also have a Q bank. So topic-wise Q bank is available. For example, I said there are 46 hours of video lectures of mine, for which we have 46 Q bank topics. So corresponding to every topic, we have a Q bank. So once you finish watching these videos, you can go back, look at the PrepLadder recorded notes again, and then start solving those MCQs. So when you start solving those MCQs, there are many advantages to it. One is repetition. There is no secret behind memory. It is just repetition. So when you solve MCQs, you're again repeating it. You're again recalling all the information that you gained. So that's one advantage. And the other advantage is, again, training the brain. So it will be a holistic approach to every topic when you do these three things in a sequential manner. And if you're asking me, what about reading a standard textbook and then watching a video? Or what about looking at some other notes and then watching the video? So if you're trying to look at textbooks, standard textbooks, there are so many standard textbooks for every subject. As all of us were mentioning, there are international authors, there are Indian authors. Let me not mention about those authors, but every book has got its own strengths. But if you're going to read one particular textbook, you're going to miss out on the strength of another textbook. What we educators have done is we had enough time, right? So minimum, any of us would have minimum of 10 years experience. So in all these 10 years, we have read all textbooks which are available for every subject of us. And we have compiled everything and we are giving it as recorded lectures and as printed notes. So this will give you a holistic understanding of every topic. So that is my take on what are the advantages a student would have if a student follows all these, if a student utilizes all these resources which are available on the PrepLadder app.
I mean, amazing. And it feels so good to know if I'm putting myself in the shoes of a first-year student, someone else has done the homework, all the homework for me. Everything is ready on the platter. All I need to do is take some efforts to eat. That's it. Sab taiyar hai, bas sirf khana hai, that's it. I think, and students should definitely be doing that.
One
Yes.
student, Meet Patel, has asked, all notes are written by the same educator faculty who's teaching a particular subject. It's purely based on the lecture that is delivered, Meet Patel. It's purely based on our knowledge and our understanding of the subject.
Yes, true that. I mean, the notes, question bank, like ma'am said, everything is in sync with the video lectures. So basically, your journey on PrepLadder starts with the video lectures, and everything is then, built up step by step. Coming to you, Rajesh sir, what do you think is the importance of solving Q bank from the first year? Should students actually be doing that right from the first year?
As I understand, and it is now, I think even the students, they know about 20%. Dr. Manna, how many questions are being asked? Like, what is the proportion of MCQs being asked in the university exam itself?
Yes, sir. In CBME curriculum, it is said that up to 20% marks should be from MCQ. So some of the colleges are putting 10 MCQs, like for us, our colleges, and some of the colleges are putting 20 MCQs also.
Right. So that way it becomes important for the students. And I have seen all the books, latest books, maybe B.D. Chaurasia or Vishram Singh, they already had started this practice of putting MCQs in the books since long. And because it is now in the curriculum, of course, it is very important for students to expose themselves to the neat pattern kind of Q bank. Of course, in the first year, they won't be asking you too many details of clinics as such, because you haven't been through the clinics yet. But still, if like even in B.D. Chaurasia, there are some blue boxes, red boxes, pink boxes, yellow boxes, and there are clinicals. So, say for example, when we were talking about, say if we are talking about the bronchopulmonary segments. Now, there's a question they will keep asking. If there is aspiration pneumonitis, then which segment will be most commonly involved? If the patient is in sitting posture, if the patient is supine posture, if it is right lateral posture. So actually we deal with those MCQs and we keep discussing in our videos. They are in the Q bank and they are the questions which may not be appearing in your university exam as such, but some part of it will definitely come. Say for example, they'll at least ask you how many bronchopulmonary segments are there in left lung. And usually students will say 10. But is it 10 or is it 9 or is it 8? That becomes a question in PG entrance exam. So basically, they are asking the same thing. The level of asking, the depth of asking that content becomes tougher and more competitive in PG entrance. Otherwise, it is the same thing. So Q bank is very essential. You should expose yourself to the Q bank right from the very first year. I believe very strongly in that.
True that, sir. I think, the journey of PG entrance preparation, it's like a long marathon. And the sooner you start, the better it is. And we have seen ourselves as students who practice Q bank, MCQs right from the beginning. They perform much better in their PG entrance exams as well. And I think we cannot deny that fact. And the best part, I believe, at the PrepLadder's Q Bank is, we proudly say that it is India's only clinical Q Bank. And it gives for every question, it gives the clinical long stem version as well. And we have a toggle option in the app, which gives a one-liner version as well. So for the university exams, the students can see the one-liner. For the NEET PG next, they can switch to the clinical and see that how the same question, the same content can be framed in a clinical manner. I think that's the best way to learn how the university concepts that you are learning can be asked as a detailed long stem question as well. And also the Q bank that we have gives the learning objective at the end of every question. I think it beautifully summarizes the topic that has been asked in the question, and it serves the purpose of revision as well. So I think it's like, ek teer aur bahut sare nishan, everything is being achieved when the students are solving the Q bank right from their first year. And Shanmugapriya ma'am, I believe that biochemistry is also one such subject where students face a lot of difficulties when it comes to MCQs, right? Like we saw the students in the recent FMG exam also. I believe the topics were the same, but just the way the questions were framed were a bit difficult. So how can students prime themselves to this, the twisted pattern of questions that we were talking?
So practice makes a person perfect, right? So if you want to if you want to get mastery over any of the skills that you want, you will have to start practicing from the beginning. So I would say if they start working out Q bank from the very first year, that would add more, that would give them privilege when compared to others. For many reasons. One is, of course, the practice that comes along with doing it from the very beginning. And number two is the brain gets tuned to be able to think it that way, because there is always a sequence in which a learning process happens. Stage one would be memorizing facts. Stage number two would be understanding concepts. And stage three would be trying to apply the knowledge that we have. And finally, it is like higher order thinking, wherein we critically think, we synthesize concepts, and we start formulating new hypotheses. So that's the last stage. But for you to reach that stage, all that you will have to do is repeat. Whatever you do, please keep repeating. And at one point, you will be surprised about your own abilities. For example, if you ask me, when I started teaching in the first year, I thought I'm great in teaching. I thought I'm great in understanding every concept, but it took some time for me to understand that it is never perfect, right? So, the more the number of times you work out MCQs, better will be your understanding of the topic. And if you look at PrepLadder Q Bank, as you mentioned, Dr. Nikita, this is the India's #1 Q bank, which is integrated, which is aligned, which is case-based. And what is more important about the Q bank of PrepLadder is, for every question, a detailed explanation is given, not only related to the right answer, even the wrong choices. Those distractors are also explained in detail, which means when you look at a similar MCQ in your exam, the moment you see the distractor, you will know this is not the right answer, this is the distractor, because I've read an explanation based on this choice, based on this distractor. So to that extent, we have thought through it, and it has been designed. And more the number of times you think about something clinically, it's not just about getting a PG seat, right? It's not just about clearing your first year exam, not just about getting a PG seat. It's all about you, when I say you, every medical student who's watching this should become a successful clinician. And for that, a conceptual understanding of a case should be initiated from the very beginning. So when you solve so many Q banks, the moment you see a particular condition in a patient, you will know, okay, if this is the clinical feature, I know this is the diagnosis. It sparks your mind and you immediately come up with the diagnosis. So to that extent, solving Q bank from the first year will help you.
True that. And coming to you, Soumen Manna sir, I believe that the most difficult part that students find in physiology is the graphs. Right. Every student has that instinct, physiological graph. Skip is the first thing that comes to our mind. So how do you think have we catered to, the graph based or the difficult questions in the Q bank?
Yeah, actually, in first year in CBME curriculum, again the CBME curriculum, they have included one part, that is the early clinical exposure, right? ECA. So they are advising that first year students should visit the clinical medicine department, clinical surgery department, and other department also from the first year. So whenever they're introducing this early clinical exposure, NMC also wants you that you should understand the clinical questions also. And for this reason, in the MCQs also, they are putting clinical MCQs. Questions based on image, question based on graphs, question which are clinical question. So MCQ, whenever you are doing the PrepLadder question bank, it is not that you are preparing for the NEET PG. You have to prepare for your university exam, and in the university exam itself they're asking clinical based question, image based question, graphs and chart based question. So whenever I have taken any classes, the graphs that has been asked in the exam, I have tried to make the graph on my own hand, right? Suppose I'm drawing one graph. First, I describe that this is x-axis, this is y-axis. First, look at the x-axis and how y-axis is changing and how it is changing. So this way, I have drawn every graph, okay, on my lecture in a lucid manner with pen and pencil pattern, right? So that way you will be able to understand the graph easily. Otherwise, what will happen whenever you look some graph on the books, na, it will be very difficult. And I have seen the Nikita ma'am has told, na, every student is they're very, very frightened about the graph. Whenever they're seeing something image-based question or the question contains some graph, they will switch up their brain at that point of time. But I can assure you, please do question bank. It will also help you building your concept. You will also get some new information. And I do recommend that whenever you are spending time doing nothing or spending time wasting your time in social media, why to waste time social media rather than scroll through the question bank? And you will obviously get some new information, some new concept. You'll be able to understand that you have read one topic, but from that same topic, how the question is being asked. Okay, so doing MCQs, it will also clear your concept, it will boost your concept also. So that it is very, very important. And for graphs and chart, you just listen my lecture. I can tell you that you are going to understand each and every graph of physiology.
Yes, I can again vouch for that, sir. I've seen your lectures and I know the way you deliver that is super awesome. Coming to the next part here. So in the PrepLadder app, we also have a section which says treasures. And I think they are treasures in their true sense, right? They deliver the topics in a very, very concise way. So how do you think that these treasures can help the students prepare for their Viva exams? You know, they're about to enter the Viva hall and they're like, chalo, ek meko topic yaad nahi aa raha, revise karna hai, let me do that. I think they can help them there. Do you think any other way they can use the treasures that can help them to revise the content again and again? Rajesh, sir.
Dr. Nikita, yes, I agree that in Viva, it is totally a different kind of scenario, because now it is you sitting in front of the faculty looking into, though you are not looking into their eyes, but you are supposed to look into their eyes, and then all the real picture comes. Means, of course, the examiner knows that aap kitne pani mein ho. So they can immediately detect like your knowledge, your depth of your ability to express yourself. But the thing is, before exam, maybe say, for example, Viva exam or maybe your university exam, the quick revision is very important. Say, I'll take one example. In my school, there used to be a chemistry book, PL Soni chemistry. So I have a habit of reading the preface always, and the author writes there. In my book, you'll be spending about 8 hours on one chapter. This is your first reading. Second reading, you will finish the same chapter in 4 hours. Third reading, you'll finish the same chapter in half an hour. And that is the half an hour you require because your exam is tomorrow. So you cannot spend 8 hours on one particular chapter in one subject because your exam is tomorrow. So you have to go fast. And that is what summary is all about. So these treasures, they are summarizing almost all the content which was given in a very quick way. And if you have been through the treasure, and if you're revising it again, you are making it super fast. So that way, treasures, they are pinpointing the important points, what the examiner is interested in asking, and you can do it quickly. And maybe say, for example, you don't have time, you don't have enough time. Say today it is, tomorrow your anatomy Viva is there, after a day there is physiology and biochemistry. You cannot go through entire content again. So the treasure helps you there.
True that. And I also think that the way we have, after every treasure, we have linked it to the MCQs as well. So I think everything is so much in an integrated fashion that, we are actually helping students lay their building blocks right from the beginning. You learn to apply whatever you have learned from the treasures when you solve the MCQs, which are linked to the treasures as well. So everything is interlinked. I think in the question bank also, with the explanation, we have linked it to the video, we have linked it to the treasures. So we have taken those efforts to give students that spaced repetition. And like Shanmugapriya ma'am mentioned, the only way to, great memory is repetition. And the students are getting that already on the app. And I don't see any reason that, a student who's starting their journey of MBBS should not be using the PrepLadder app to give them that first mover advantage. Yeah, and one more important feature that we have, and so Shanmugapriya fam, if you can introduce our viewers to the new feature that we have, that's the Prep Vocab.
Yeah. So Prep Vocab is a new feature that is introduced on PrepLadder app, wherein for every medical terminology, which you find it difficult to understand, all that you will have to do is you will have to go close, you have to reach that word and you'll have to highlight it. And immediately what pops out is an understanding, a meaning of the term that was highlighted by you. And I would say this is a boon for every medical student, because I clearly remember me hunting and going around searching for a medical dictionary. Every time I find it difficult to understand a term. Many a times I would miss my dictionary and I would be hunting for it everywhere. So here everything is available in your hand. And at your own convenience, you can look at it and you will be able to. So this will help you in getting your doubts clarified real time. So many a times, because we are not able to get an access to an understanding of the word, we just end up memorizing it and then we forget it. And you don't have to face that difficulty. Everything is available on the app. I am a big fan of this Prep Vocab feature. Because it's like a nostalgic feature for me. I get reminded of what we used to do looking at a hard copy of the dictionary. So this is really good.
Yeah, to that, an absolute time-saving feature that we have introduced on the app. I think students can definitely go Google the term, but that takes a lot of time and it's a distraction as well. When you go through some other app, you're bound to get distracted. So we have taken all the efforts to prevent the distraction as well. Over to you, Soumen, sir. Yes, sure, sir.
I remember in my pathology subject, the examiners, they were very peculiarly, they used to ask us, you have to tell the definition word by word. And even in psychiatry, like if you misplace any word, then they'll ask you to tell the definition again. And in a way, like I still remember some of the definitions, like let me give you an example. What is delusion? Delusion is a false personal belief which will persist despite proof to the contrary. Now, it is all mugged up words. Later, I understood that what do you exactly mean by delusion, but I have mugged up. So these dictionary meanings are very important. And sometimes, just by जिसको हम हिंदी में कहते हैं संधि विच्छेद, you break up the word and then you again realign the word. And you don't need to remember, it's like it is, see, enophthalmos, enophthalmos, like I don't know like which way you pronunciate, but enophthalmos. Now, what does it mean? The word itself tells you what does it mean. So you need not mug up the things. In fact, most of the in anatomy itself, the word itself will tell you what I am talking about. So that way, this vocabulary thing and this dictionary thing is a great asset. As Dr. Priya has mentioned, she used to search for it, and she is rightly, it is very true. Like our seniors used to tell, you must be able to define in a crisp manner, short and crisp manner, and should not misplace the words here and there. So I think it is going to be a very handy tool now for the students.
Yes, absolutely, sir. Absolutely. Coming to you, Soumen Manna, sir, what do you think? How can students, who are in their first year as well, they can use the bookmarks, they can use the subject-wise test, especially the first-year subjects test, how they can utilize that once they finish the subject? How can they make the best use of that?
Yes, whenever a student is reading some topic, right? If you are finding that some topics are very, very important and the question in the university exam, the questions is coming up from the topic. So you can bookmark that topic so that you can easily go back to that topic later on. First of that, second thing is that whenever you are reading any subject, if you bookmark some particular or important thing, you can revise those things later on in a very quick fashion. Although treasures are there, treasures are in the form of summary. But again, we have a habit of bookmark some topic in hard copy also. That this page are very, very important. This page I have to go back again because I'm forgetting this topic. So that way, whenever you are reading something, please use the option to bookmark that you have to go back this topic later on because this is difficult for you. You are forgetting this topic, and this topic is important for you because you have to read this topic again and again because it is coming as a question in your university exam. So that way, the bookmark is going to give you a very much helpful for your university exam also. And for test series, whenever after finishing any topic or any subject, if you give a test, right, you can judge yourself that how much you have learned and how much you are remembering, because whenever you are reading something now, we have a habit of forgetting many things, right? So that way, whenever you are reading something, you are going to forget 20 to 40% for sure. Okay, so how to remember those things which you are forgetting? If you give more and more tests, if you are solving more and more MCQs, and whenever you are getting time, go through the treasures in scrolling fashion, so that will give you your boosting for your memory. So that way, I think it's going to help the student.
True that. And I was just thinking, what if a first year student giving the subject wise test along with the interns and, gets the top scores? I mean, that would be like, what out of the world feeling ki first year mein itna zyada score kar rahe hain. And I think, do you think that is really achievable if they do this right from the beginning?
Totally.
Yeah, there are students who are gold medalists in the very basic subjects like anatomy, physiology, biochemistry, and they will definitely beat even their seniors who have been through a burden of 18, 19 subjects. And if it is just anatomy or maybe physiology, biochemistry, they'll definitely beat them there. It is possible. I agree to that, and that will be a super confidence booster for them. In fact.
Yeah,
Yeah.
true that. True that. And we are waiting for such students to let us know their story that really this worked for them. And we are waiting for some tags happening on the Insta stories telling that, this really worked. That's great. So coming to the last part of our session today, I think we had a great session with a lot of valuable inputs and insights, especially for the first year students who might have been very clueless what to do, how to do, whether they should be actually using the PrepLadder app. But still, I would ask the viewers, if you have any queries, if you have anything that you want us to answer, please feel free to write down in the live chat. We shall be happy to help you. Pratiksha is saying, please give strategy for third prof. Yes, Pratiksha. So we'll be having such sessions for all the profs. So started with the first prof. So we'll have similar sessions for second, third, and the majors, the third majors prof as well. So we'll be doing it in some time soon. Other queries that we have is Meet has been asking this persistently, though it is a bit of a deviator from a topic of discussion today. But I think since we have the expert educators for first year, if we can help him understand that how to approach the first prof subjects for NEET, as there is for the NEET PG 24, basically, as there are only 4 to 5 months left. Should they be integrated or should they be done individually? I think what the student needs to ask is, should we do them like, system wise, कि जब हम cardiovascular कर रहे हैं तो anatomy साथ में कर लें and physiology साथ में कर लें, or should we do them individually? So what would be your take on that, Soumen sir?
Actually, it depends from student to student. What I feel that you should do the subject individually rather than finishing one topic from multiple subject. Okay, if you do one subject first and then move on to the other subject, or you read some part of physiology or some part of biochemistry or maybe some part of anatomy, that way it will be better rather than connecting everything. That if you're reading cardiovascular system from physio, you have to read cardiovascular system from pathology and medicine also. So I think individual reading is better for me. But as I told, it's suits a different person differently.
True that. Anybody else has some inputs to give on that? Shanmugapriya ma'am or Rajesh sir?
So I've been seeing Meet Patel in many of my live YouTube sessions. I'm very sure that he has been preparing for quite a long time. So Meet Patel, please don't change any strategy just because there is a change in the way exam is being designed. So a change in the pattern of exam does not mean you'll have to change the pattern in which you learn. Please continue the way in which you have been learning all along. The moment you start applying the knowledge, your brain automatically starts integrating everything. So you don't have to integrate system-wise, because I'm very sure you did not learn your undergraduation that way. So continue with the same way that you have been doing it. Learn subjects individually, but apply the knowledge. Try to apply the knowledge that you have gained by working out MCQs, which are integrated, which are aligned, and that by itself would be more than enough. And if your question is about how to prepare in the short period of time that is available, it is based on your level of preparation for all the three subjects. For example, like most of the students, if you're strong in anatomy, but you're weak in biochemistry. So this is an anecdote which I would like to share here. Whenever I go meet any batch of students, the first question that I would ask is, though I know what the answer would be, I just ask how many of you like biochemistry. I hardly see one or two hands raising up, which is understandable because the way the subject has been perceived so far. So if you're one such a student who's not very strong in biochemistry, in that case, you will have to watch the entire, the complete videos which are available, and then you start working out MCQs. But if you are very clear in biochemistry, then watch rapid revision videos and solve MCQs. Solve MCQs from the Q bank. That by itself would suffice. So your preparation for anatomy, physiology, and biochemistry, you will have to make a decision on it based on how strong are you in all the three subjects. I hope I've answered your question.
Yes, ma'am. Very well. I think very, very clear. And Ranjan is asking, how much time should we give to each subject in first year? Personally, if I have to take this, I would say that the best thing to do if you are a first year MBBS student, and if you're asking that question from that perspective, ki first year mein, kitna time should be given to what subject? The best thing that you can do is follow the lectures that are happening in the college. By the lectures, I mean the schedule that's happening. Make sure you are on time. So let's say for tomorrow, it is respiratory physiologica class in your college. So make sure you're watching the video on the PrepLadder app before that. Once you come back, you revise that, you solve the questions, you're done and dusted with that. And whatever you have through the entire week that you have studied, make sure, I know that this might sound like a bit of a lot of nerd thing, but you have to do it. Utilize your Sundays, at least to revise whatever you have learned in the entire week, because that helps you, to make your synapses stronger and to remember things better. The faster, the sooner you revise, the better you will remember the things. Otherwise, at the end, you will again be back to square one. So that's the only cycle that you have to follow, I would say. Whatever lectures are being taken, prepare them beforehand, and that would give you an extra edge. I hope all of you would agree to that.
Totally. Yes.
That's great.
Nikita, I would like to add something here. We have been talking about academics. Suddenly I realized that the student must be thinking that they are taking us as robots, and robotic instructions are being given. What I believe, like I just remember my first year MBBS and my schedule which I followed throughout MBBS. So I would like to add something which is extracurricular here. I used to cycle a lot. I used to swim a lot. There was a swimming pool, and I'll just go in the morning, some 4:35 session. So swimming, cycling, or at least jogging, whatever you like, you should continue with that. Maintaining your health is very important. That is physical. And when it comes to mental faculties, again, you should continue with whatever you used to do in your school time, maybe reading novels, or maybe reading comics itself, because of course academic books you already are reading, so reading habit should continue. Or these days mostly people watch Netflix or maybe Apple TV, whichever series you are interested in, you should continue with that. It doesn't mean that you have to binge watch, means you can allocate your time accordingly. The wisdom should come from you. And plus you should eat healthy. Eating healthy means you should take your carbohydrates, of course, but you should include fruits and salads. So this is what I used to do. And surprisingly, I used to be some 59.5 kgs during my entire MBBS. I never touched 60 kgs. Now I am 86 kgs. So just imagine that 26 kgs I have gained. Just why? Because I have passed my MBBS and now I am doing my PG, and all those habits are gone almost. Though there is a cycle, but that cycle is stationary. So I don't cycle on the roads now, and maybe in Delhi it is not possible, even possible. But continue with your physical and mental activities, and some good food habits should be continued.
Thank you so much, sir, for that great piece of advice. I think one of the neglected things that you have highlighted. Thank you so much for doing that. I believe it is a holistic development that all of us should look at, whatever we are pursuing in our life, but it has to be done holistically. Yes. Thank you so much for all the valuable inputs and insights, all the faculties here. I think we have helped a big time to the first year students. Thank you so much for sparing your time. And let us tell our viewers as well that this is not the only time that we are here for you. You have any queries related to whatever during your MBBS journey, we are just one message away. So once you are there on the PrepLadder app, you also get access to the PrepLadder premium group on Facebook, where we answer your queries. So if you have any difficulties you're facing, during your preparation, not understanding anything, you can tag us there. We shall be more than happy to help you. And we are waiting to hear from you soon and waiting to see you on the other side very soon. Thank you so much, everyone, for joining in.
Thanks a lot, Dr. Nikita, Dr. Manna, Dr. Priya.
Thank you, sir.
And students, all the best. Our wishes stay always with you.